Retention here at IHA is so important for so many reasons. It's important for our patients to see consistent smiling faces when they walk in the door. It's important for our providers to also have that consistency of staff. And really just organizationally, we pride ourselves in longevity here, and we have conversations with their staff about growth opportunities. And I think, from our retention standpoint, that's really what folks are looking for is, it's not just about the job. It's not just about the money. It's about that personal connection. And so what we see then are good comments from folks about, I love working at IHA. I wouldn't go anyplace else. I have a great experience when I'm working here. Those are the people that we've affected, we've retained, we've been able to help them grow throughout their professional career.
I actually started at IHA on my medical assistant internship at Mylan Family Care and kind of went from my externship right into a medical assistant role. And then there was a posting for the clinical coordinator at Cherry Hill Internal Medicine. And so I applied and I got that job. From there, I was looking for further growth opportunities. And at that time, there was a new position in the IT department called a education specialist. But my background was clinical for 8 years at that point. And so I was a little bit nervous, but I did apply and I came for the interview with Tracy Hamilton at the time. And she offered me the position. It was hard for a little while there. I kept thinking, I probably made the wrong choice here. I just kept telling myself, give yourself some time, give yourself some time. And then sure enough, it ended up working out in the long run. And then over time, I was promoted from that to the division trainer. And then just recently, we restructured into 3 separate teams. So your ambulatory team, your clerical team, and the service line team. Huge growth opportunity for me again, right? I've learned so much on that side that I clinically and Epic-wise that I had no idea even, that we did all of these years. So it's been very eye-opening and very nice.
Getting to fully staffed is our IHA priority. It's bringing people in, but it's also keeping them paid appropriately for the work that they're doing and giving them opportunities. We want to see people grow. And thinking about our customer program, that's been a part of IHA for a very long time now.
My first role when I came to IHA was I was the receptionist at Cherry Hill Internal Medicine. I kind of was hesitant at first because when I first started at Cherry Hill, our phones were out of control. And I was really concerned did I make the correct decision? When I went to the customer, which is the program that they give us to help mentor us as employees, I met Bill Folletti, our founder. And he took the time and spoke with every one of us after that customer meeting. And he made me feel like I was the only person in that room. He made me realize that I wanted to be the patient advocate. I wanted to be the one to help take care of our patients. And I knew that I was doing the right decision by staying with IHA. A couple of years there at Cherry Hill, and then I moved on to Plymouth because I was looking for more growth. Over there, I was receptionist, and I got to move up to being a reception supervisor. I worked there up until June of 2021, and I moved up to the practice manager here at Neighborhood Family Health Center.
The appeal to working at IHA is our people and our culture. Our culture is it's founded in our CARES values. And as we have new folks coming into the organization, or we talk with folks throughout the course of our work, we hear a lot of great things that people really feel we act in accordance with our CARES values. We have just such an excellent way of looking at how we treat our patients and our internal customers, right? How we treat each other.
My passion for our patients is I care for them, and that's what I think our leadership does for us. They care for us, and they care for the staff, whether you're a receptionist or a doctor. And that's the most important thing I feel like with IHA is they consider us all equals.
I don't have, a bachelor's degree or an associate's degree, and I just appreciate IHA and I love them so much for looking at people like me and really saying, she can do the job or he can do the job, and you don't necessarily need that, degree to get to where you want to be in life. They treat you like family, and they really do look to provide growth within. And it's just, you cannot say that about a lot of places, that's for sure.